Prevention and intervention strategies. This is the art of public health, right? Public health is both the art and the science of preventing and promoting health, etc., right? So when we think about the art aspect of public health, it is the prevention strategies. And we take all that evidence, right, from the assessment phase of public health, and then we apply it to the policy development phase of public health, which is where we are creating the solutions. And how do we create solutions in public health? Is by creating prevention and intervention strategies. And there is a difference between intervention and there is a difference between prevention and intervention strategies. But at the end of the day, we're going to learn that intervention strategies is definitely much a part of a prevention strategy. And so public health focuses on both prevention and intervention to reduce the burden of disease and promote well-being. When we talk about prevention aims to stop something from happening, right? So before it ever gets the opportunity to start public health or prevention comes in and stops it. And so really it's to reduce and it does this by reducing risk factors, promoting healthy behaviors, and addressing environmental and social conditions that contribute to the problem. And the goal of prevention is to reduce the occurrence of something. Also, it's a proactive measure, such as education, policy change, and access to healthcare. And really what it does is it wants to stop something from ever starting. Intervention, on the other hand, intervention is there's a problem already happening. And so we are going to intervene, get right in the middle of it in order to stop it. But in doing so, we are also preventing it from going forward. So we can say intervention is a type of prevention strategy. The difference is that pure prevention, prevents before it even gets started. Intervention, there's a problem happening and we are going to intervene and stop it from going even further, preventing it from going even further. So intervention is a focuses on responding to existing health problem by managing or treating diseases, reducing complication, and improving patient outcomes. The goal is to minimize the impact of the disease and injuries once they occur. And this is more reactionary measure, such as medical treatment, emergency response, or rehabilitation. It's reactionary because something's already happening and we're going to get in the middle of it and stop it from continuing going forward. As opposed to prevention is proactive where nothing's happening and we want to make sure it stays that way, that nothing is happening. So it's proactive before it even begins. Example would be treating patients with diabetes through medication, diet counseling, and glucose monitoring, etc. So when we're looking at prevention strategies, there are 5 main prevention strategies for public health. We have primordial, primary, secondary, tertiary, and quaternary. And primordial really focus on limiting risk before they develop. So that means that we are using policy, right? One of the biggest things for primordial is we are using rules, laws, regulations, and policies in order to not even give people the opportunity to do something, not even be able to be allowed to do the behavior. Primordial means before. So we are going to, before you even think about acting, we're just going to let you know right now, you cannot do it, right? And what that does is it shapes social norms. It also shifts the environment that people are in as well, because people are not able just to do because there's a rule, law, regulation, or policy not allowing them to do. And then we have primary prevention, and primary prevention is all about providing education. So the hopes is that we educate the people either through like using commercials, billboards, etc., in order for them to understand like, okay, I'm not going to do this behavior. I don't want to do this behavior because I don't want that negative outcome. So it's trying to prevent them from ever doing something. Now they still have choice here. Primordial, you don't have a choice. You're not supposed to do it, right? Ultimately, yes, everyone has a choice. I get it, right? You break the law, fine, if that's what you want to do. But at the end of the day, the truth is primordial is focusing on taking away the choice, while primary is people still have a choice, and what we're doing is we're educating them so the hopes that they choose the right choice. Secondary is all about screening, early detection, so it's very specific. It's not general like the other two is very general, trying to get the information out as much as possible, making sure everybody is impacted. But secondary is focused more on a targeted group of people, right? Public health has very limited resources. So, in understanding that, we cannot afford to vaccinate everyone, we cannot afford to treat everyone. So, when you think about that, um, uh, we can't give everybody treatment. Like when COVID happened, people were going to get screened, and like if you had COVID, you got the treatment. If you didn't have COVID, you got the vaccine, and that's kind of how we did it. There's no point in you getting the vaccine if you currently have COVID because it was preventative, and once you have it, you have it. Then you got to wait for the next vaccine or the booster in order to make sure that you don't get the next strand or mutation of COVID. But the vaccine is useless to you at this point. But if you haven't had it, right, then the vaccine is perfect for you, and we don't have to give you treatment because you don't need it. Similar to if you think about mammograms or prostate exams, etc. Especially like prostate exams, you're not going to give a woman a prostate exam because she doesn't have a prostate. So you're only going to screen men. So very targeted. So tertiary prevention is managing disease to improve quality of life. So meaning that with tertiary prevention, someone has the disease. And so if someone has a disease, there's sometimes not much we can do for them, but we can help them manage it. So what we're focusing on is stopping the progression of disease. So what that means is like if someone has HIV, you may or may not know, but HIV progresses to AIDS. When someone has a CD4 count, I believe below 20, then it progresses to AIDS. So the goal is to keep people in the HIV phase as long as possible so that they do not transition to get AIDS. The longer someone's in the HIV phase, the longer life and quality life that they will have. But once they get into AIDS phase, it's more marked with like decline in health, etc. And then quaternary phase is trying to prevent over medicalization or unnecessary treatment. So it's really focused on harm reduction. And when you think about it, is in essence what quaternary does is it is trying to make sure that people who seek care are not leaving off worse than they came in. For example, a kid who has a broken arm, you don't want that kid to go in with a broken arm, but then also contract COVID, right? We want to prevent that from happening. So when we think about primordial prevention, it's about preventing social, economic, and environmental conditions that contribute to disease. So once again, that is looking at the rules, laws, regulations, and policies in order to do that. That's how we impact society, the social, that's how we impact the environment, that's how we impact the environmental conditions is through rules, laws, regulations, and policies. Also, too, by creating infrastructures as well, that also be a part of primordial. But in order to put an infrastructure within a city, you have to have an ordinance, you have to have some type of government vote, like from the city council, the mayor directive, etc. You can't just do. And so, once again, that's the primordial prevention. And CHW's role in primordial prevention is educating communities on how the environment affects their health, advocating for policy change that create healthier living conditions, and work with city planners to increase green spaces and safer neighborhoods. And we're looking at primary prevention. The main focus here is education. So really understanding how to stop disease before they develop by promoting healthier behaviors and reducing exposure to risk factors. So they used to have all these commercials about people using drugs, and they used to look at this is your brain on drugs, and it'd be like eggs frying in a pan. And so those are like health education commercials in order to educate people on the effects of drugs. And you also could see like when COVID happened, there's a bunch of billboards saying go get vaccinated, or showing the percentage of people or the prevalence rate of people who are currently sick or dying, etc. So primary prevention is really focused on educating people. Primordial focusing on rules, laws, regulations. Primary prevention is focused on educating the people. And so CHW would organize a vaccination drive or a health fair, provide nutritional and exercise workshops, or offer smoking cessation support. So secondary prevention is all about trying to detect early, right? It's more targeted at a population. We know that there's a disease here. We know that there's a problem here, but the problem is we don't know who specifically is impacted. So we need to go ahead and screen people for early detection. So while primary prevention is focused on rules, laws, regulations, policies, primary prevention is focused on education. Secondary prevention is focused on screening and early detection. So this could, for CHW, this looks like conducting community health screening outreach, encouraging at-risk populations to seek medical checkups, or help individuals navigate the healthcare system for early treatment. Tertiary prevention is all about managing disease, so reducing the impact of existing diseases by improving disease management and rehabilitation. So really focusing on, this is someone who already has the disease. We know they have the disease, and so we need to go ahead and try to stop the progression of the disease so they don't get worse. So primordial prevention is focused on preventing a disease through rules, laws, regulations, and policies. Primary is focused on education. Secondary is focused on screening or detection. And tertiary is focusing on disease management, right? We're trying to slow the progression of disease. Someone has it, and we want to slow down the progression of disease. And so a CHW might teach self-care techniques for chronic disease management, connect patients to rehabilitation services and support groups, and provide medication adherence support to prevent hospital readmission. And then lastly, we have quaternary prevention. And quaternary prevention is focused on avoiding unnecessary medical treatment that cause harm and financial burden. So while primordial is focused on rules, laws, regulations, and policies, primary is focused on education. Secondary's work is focused on screening and early detection. Tertiary is focusing on disease management, right? Really trying to stop the progression of disease. Quaternary is focused on making sure that people who are seeking care do not leave worse off than they came in, right? We do not want to continue that. A prime example is when we think about the opioid crisis or epidemic. And so someone came in for back pain, they were prescribed opioids, they became addicted to opioids, their prescription ended, so then they weren't able to get opioids, so now they're doing heroin not strong enough, so now they're doing fentanyl, and then they end up dead, right? So we want to make sure that people don't progress that way. The person came in simply for back pain. They didn't come in to get addicted to drugs, right? But that's ended up what happening. So we need to be able to reduce harm. So we need to make sure that people who are seeking care do not leave worse off than they came in. And so that's what quaternary prevention is all focuses on. So CHW, educate patients about evidence-based treatment options, advocate for holistic and patient-centered care, and help individuals seek second opinions before high-risk treatments. And that is it for the prevention strategies. For intervention strategies, some of the things to understand is, once again, intervention strategies are really, there's already a problem, so it's very focused. We are intervening right in the middle of it, and we are preventing it from going forward. So it aims to improve health outcomes, reduce disease burden, and address social determinants of health. So common intervention strategies is health promotion interventions, disease prevention and screening interventions, community-based interventions, policy and advocacy interventions, environmental and structural interventions, crisis and emergency response interventions, and behavioral change and support and social support interventions. And so CHW typically act as the lead when it comes to public health interventions. CHWs tend to have multi-level roles in implementing public health interventions. They do health promotion and disease prevention efforts to help stop illnesses before they develop. They may do community-based and policy interventions by improving public health at a systemic level. Um, Crisis response and behavioral support strategies help individuals and communities recover from emergencies and sustain well-being. So when we look at the health promotions, interventions that encourage healthy behaviors and lifestyle changes, focuses on education, awareness, and community engagement. And then CHWs provide health education sessions, develop culturally relevant health messages, and organize community events. When we look at disease prevention and screening interventions, um, really it's focusing on identifying disease and risk factors early to prevent complications and improve treatment outcomes, focus on preventive screenings and early detection strategies. So CHWs may conduct community-based screenings, encourage at-risk populations to participate in routine check-ins, and provide referrals and follow-up supports. For community-based interventions, it really addresses local health challenges by engaging community members in health programs designed to be tailored to specific cultural, economic, and social contexts. So when you think about CHW's role in this, is partnering with local organizations, identifying culturally appropriate solutions, and also mobilizing residents to participate in health initiatives. When we're looking at policy and advocacy interventions, it's really focused on implementing laws, policy, and regulations to improve public health and reduce health disparities. It focuses on systemic changes that make healthcare and healthy living more accessible. So CHW may advocate for health equity policies, educate policymakers, and help communities navigate public programs. And then we're looking at the environmental and structural interventions. We're looking at improving living conditions, infrastructures, and environmental health, focus on modifying physical and social environments. CHW's role is to work with local officials to improve environmental health policies, educate communities about environmental hazards, and then advocate for safer and healthier community spaces. We're looking at the crisis and emergency response interventions, really looking at how do we provide immediate health support during public health emergencies and disasters, focus on preventing disease outbreaks, ensuring safety and delivering aid. So looking at CHW's role in providing emergency health education and outreach, assist in disaster response efforts, and connect disaster survivors with medical and social services. Behavioral change and social support interventions. It's really looking at encouraging long-term behavioral change through education, peer support, and mental health resources, focuses on social networks and psychological supports. So CHWs may facilitate peer support groups, empower individuals to make lasting health behavior changes, and encourage social support networks to improve mental and emotional health. There's this concept when it comes to prevention and intervention strategies, where's health co-benefits. And we're talking about health co-benefits. It refers to positive side effects of health interventions that improve not just one aspect of health, but multiple outcomes simultaneously. These benefits extend beyond the intended goal of a public health initiative and create broader social, economic, and environmental improvements. So some examples, the health co-benefit is improving air quality. It reduces respiratory disease and lower cardiovascular diseases. It increasing access to green spaces. It promotes physical activity and improves mental health. Encouraging activity transportation, it reduces obesity and pollution-related illnesses. So when you're looking at health co-benefits, it's getting the most bang for our buck when we design intervention and prevention strategies, right? Where even though we are focused on one thing, that thing might have ripple effects and impact other things as well, which is a good thing, right? And now we're trying to treat one thing, but we end up treating multiple things with the solutions that we come up with. More examples is a city implementing bike lanes to reduce air pollution. Not only improves lung health, but also encourages physical activity, which lowers obesity rates and reduces cardiovascular disease. A CHW working in a food desert helps establish a farmer's market, leading to better nutrition, increased social interaction, and economic growth for local farmers. And that is it.